Module 3, Explaining Special Needs Population, Unconscious or Unresponsive Clients. Sometimes you will be caring for clients who are unconscious or unresponsive. This means that they may be unaware of their surroundings. They may not respond when they hear activity or noise around them. They may not respond when you touch them or ask them questions. They may be unable to speak or to move purposefully. They are incontinent and do not have control of their bowel or bladder. They cannot express preferences or work towards independence. This unresponsive state may be your client's normal state due to a disability or an ongoing condition. Or this state may be temporary as a result of a medical procedure or an illness. Regardless, even though they lack the ability to communicate and respond, their dignity, privacy, and safety should not be compromised. When you are caring for these clients, it is important to humanize that care. That is, your client should be treated like a person, not like an object. Protect their privacy during the procedures just as you would with a conscious client. Talk to your unconscious client just as you would with any other client. Talk directly to the client. Alert the client to your presence and greet the client. Hi, Matteo. It's Jen here. I'm looking after you today. Hello, Maria. How are you doing on this beautiful sunny day? Explain what you are going to do before you do it. I'm here to take your blood pressure, all right? I'm going to give you a back massage. We want to keep your skin on your back healthy. I'm here to give you a bed bath. Is that all right? I'm here to clean you up and change your bedding. I'm going to brush your teeth now. Your mouth will feel much fresher. Explain what you are doing and what they might feel as you do it. All right, I'm just taking your blood pressure. You'll feel some squeezing on your arm here for a moment. Okay, I'm just rolling you over onto your side. Okay, it's going to feel a little chilly for a moment when I move the blanket. Okay, I'm rubbing your legs with lotion. This smells a little odd. It's just the smell of the hand sanitizer. I'm brushing your hair. How does that feel? Engage in natural conversation. You might chat about the weather, a special holiday that's coming up, a family member that's coming to visit, something in the environment, maybe a picture or flowers or an item of clothing, or how nice the lotion smells. How they feel after the procedure, noises in the environment that may be frightening or annoying. For instance, if a door slams or if a loud buzzer goes off, or if there is a loud shouting from another client, explain what they are hearing. Model this kind of interaction for visiting family members. It is important that clients hear familiar voices talking to them. In fact, talking to unconscious clients can reduce traumatic experiences and memories, so remind family members that we don't actually know what the client's level of awareness is. Encourage them to talk to the client just as you are doing, about anything that they would normally talk with a client about. Include the client in your conversations with their family members. Hey Arnold, I see your wife is here to visit. Hi Mary, how are you doing? How is work going for you? Busy? Well, it's been pretty busy for us here for us too, right Arnold? We've had a number of patients coming in and out of the room this morning. Don't say things around your unconscious or unresponsive client that you wouldn't say in front of a conscious client. Don't complain about them, their family members, or other staff in front of them. Don't talk about the client's status as if the client isn't there. When you leave, let them know you are leaving, just as you would any other client. Hey Arnold, I'm leaving now. I'll be back in an hour to check on you. The key thing is always remember that you are working with a person when you are caring for an unconscious client, and encourage others, family and staff, to do the same.